Mental illness in Jamaica, a crisis hidden in plain sight. Mental illness affects Jamaicans in every community, income group, and age bracket. Yet, for many people, the struggle remains hidden behind closed doors. Depression may be dismissed as laziness. Anxiety is sometimes interpreted as weakness. A person experiencing psychosis may be mocked, feared, or abandoned instead of receiving medical attention. Meanwhile, many families attempt to manage serious conditions without adequate information, financial resources, or professional support. Mental illness is not a lack of discipline or faith. It refers to a range of medically recognized conditions that can affect a person's thoughts, emotions, behavior, and ability to function. These include depression, anxiety disorders, bipolar disorder, schizophrenia, post-traumatic stress disorder, and substance use disorders. The scale of the problem. There is no single regularly updated national survey that captures the full prevalence of mental illness in Jamaica. This is itself a major weakness. Without timely data, authorities cannot accurately determine how many people need care, where the greatest needs exist, or whether interventions are working. Available figures nevertheless reveal considerable demand. A government report published in 2022 said Jamaica's National Community Mental Health Service was managing an estimated 23,500 patients with 334 mental health workers. This caseload represents only people who had entered the public system, not everyone experiencing a condition. Many Jamaicans never seek professional help because of stigma, cost, limited awareness, or difficulty accessing a specialist. The Ministry of Health and Wellness reported in 2025 that calls to its mental health and suicide prevention helpline increased from 888 during its first year of operation in 2019 to 2,944 in 2024. The ministry described this as a rise of almost 70%. Greater use may reflect both increased distress and improved willingness to ask for help. Young Jamaicans under pressure. Children, adolescents, and young adults are among the most vulnerable. Family conflict, violence, bullying, academic pressure, unemployment, financial insecurity, and social media exposure can all affect emotional well-being. Trauma experienced during childhood may also have consequences that continue into adulthood. At the launch of the You Matter Youth Counseling Service in 2022, UNICEF reported that 1 in 4 Jamaican students had considered suicide. The ministry also indicated that as many as 60% of the people treated at hospitals after suicide attempts were adolescents and young adults under 24. Demand for youth support has continued to grow. Between January 2025 and May 2026, UMATA opened 3,662 cases and closed 2,448. Since its launch, the service has facilitated more than 9,500 contact sessions. These figures do not establish how many young Jamaicans have a diagnosed mental disorder, but they demonstrate a substantial need for accessible counseling. Early intervention is especially important because the ministry says most people who develop a mental illness show some signs before age 14. Teachers, parents, and healthcare workers must therefore be trained to identify sustained changes in mood, behavior, school performance, sleeping patterns, and social interaction. Stigma remains a major barrier. One of Jamaica's most persistent challenges is the language used to describe mental illness. Terms that ridicule or dehumanize people discourage them from disclosing symptoms. Families may hide a relative's conditions out of shame, while employees may avoid seeking treatment because they fear losing their jobs or being labeled unreliable. Religion and community support can play valuable roles in recovery, but prayer should not be presented as a replacement for professional assessment and treatment. Mental health conditions may require counseling, medication, social support, or a combination of interventions. Stigma also affects people living on the streets. Some may have untreated psychiatric conditions, but homelessness and mental illness are not interchangeable. A responsible response requires assessment, housing support, rehabilitation, and continuing care, not simply removing people from public spaces. Violence and mental illness. Public discussion sometimes creates the impression that mental illness automatically makes a person violent. That belief is misleading and harmful. Most people with mental health conditions are not violent. In many circumstances, they are more vulnerable to neglect, exploitation, homelessness, and abuse. Risk can increase in particular cases involving untreated severe illnesses, substance misuse, or an immediate crisis. But each situation must be assessed individually. Violent behavior should not be casually used to diagnose someone. Only qualified professionals can determine whether a person has a mental health condition. An overstretched care system. Jamaica has moved away from relying exclusively on institutional care and now provides mental health treatment through hospitals, community clinics, health centers, and home visits. This community based model allows some patients to remain close to their families while receiving medication and follow up care. However, shortages remain. In 2025, the government announced plans to accelerate the recruitment of psychiatrists, fill vacancies, and add mental health officers and psychiatric nursing aides. The stated objective was to reduce waiting times and strengthen intervention in homes, schools, and communities. The announcement was an acknowledgement that existing capacity was insufficient. Access may be especially difficult outside major urban areas. Private psychological and psychiatric services can also be unaffordable for low income households. Even after receiving emergency treatment, some patients struggle to obtain consistent follow up care, medication, stable housing, or employment. The economic and social cost. Untreated mental illness affects more than the individual. It can contribute to school absenteeism, unemployment, family breakdown, homelessness, substance misuse, and reduced workplace productivity. Relatives may leave their jobs or reduce their working hours to care for someone with a serious condition. Police officers and emergency departments may then become the first point of contact during a crisis, even though the individual primarily needs healthcare and social support. Investing in early treatment is therefore not merely a health expense, it can reduce pressure on hospitals, families, schools, workplaces, and the justice system. What Jamaica must do. A stronger national response should include regular national surveys measuring mental health conditions, treatment gaps, and suicide related behavior. More psychologists, psychiatrists, psychiatric nurses, social workers, and counselors across all parishes. Mental health screening and referral services in schools and primary care facilities. Faster crisis response teams involving trained health professionals. Affordable medication and reliable follow up care. Greater protection against workplace and school discrimination. Supported housing and rehabilitation for people with severe, persistent conditions. Public education that replaces ridicule and fear with accurate information. Strong assistance for families caring for relatives at home. Mental health support built into disaster preparedness and recovery. a public health issue that cannot remain hidden. Jamaica has taken important steps, including community-based treatment, a national crisis helpline, school programs, and confidential counseling for young people. But the rising demand for support indicates that mental health must occupy a more prominent place in national policy. The country must also change how it speaks about those who are struggling. A person experiencing depression is not simply ungrateful. A child with anxiety is not necessarily seeking attention. Someone experiencing hallucinations or delusions is not an object of entertainment. These are human beings who may require urgent, compassionate, and sustained care. Mental illness can be treated, and recovery is possible, but treatment begins only when people feel safe enough to ask for help, and when the system is equipped to respond. If you or someone you know is experiencing a mental health crisis in Jamaica, contact the 24-hour mental health and suicide prevention helpline at 888-639-5433. Young people can also message support to 876-838-4897 through You Matter for free. Confidential counseling. If there is immediate danger, contact emergency services or go to the nearest hospital.